I'm Megan O'Shifernini, and let's talk robots. For years, we've dreamed of a life where the robots would take over, possibly finish all of our homework for us. But what about robots in medicine? More specifically, surgery. So today, let's talk about robotic surgical assistants. So what exactly are they? A robotic surgical assistant is a robotic system that aids surgeons in performing surgical procedures. These assistants offer surgeons a 3D and HD view of inside the body. And while there's still plenty of time for full-on robotic surgery, the use of robotic assistants has actually increased over 13.3% from 2012 to 2018. And especially with the rise of the COVID-19 pandemic, their use has greatly increased due to the safety measures they present, as the surgeons are no longer having to be in direct contact with patients. So what exactly are the benefits of robotic assistants? First, they are less invasive because they only make small incisions into the skin through which the robot is inserted. Additionally, they provide milder risk factors for these same exact reasons. And finally, they allow for increased accuracy and precision as the surgeon is able to control their movements with the robot into the small incisions made into the body. So next, let's look at the evolution of these robotic assistants and how they developed. So beginning in 1958, the first robotic assistant to be created was the Puma 560, which was developed by Dr. Yik San Kwa. And while this successfully placed a needle in the brain for a human brain biopsy, it later led to the development of the most surgically advanced system, the Da Vinci systems, which were created in 1995 and have performed over 7 million procedures. The Da Vinci systems are the most popular RAS devices, or the robotically assisted surgical devices. These devices are most commonly computer assisted, and what these allow surgeons to do is they allow them to control the robot with the use of computer and software technology and allow them to move through one or more incisions that are made inside the patient's body with a clear view. Robotic surgical assistants have a long future in hospitals, with a global surgical robotics market forecasted to grow from 3.9 billion to 6.5 billion by 2023. So, as we discussed before, robotic surgical assistants reduce pain, they allow for a quicker recovery process, they actually are cheaper to implement in hospitals in the long run, and lead to smaller and less invasive scars. And so while we dream of a world where the robots would take over, do everything for us, we won't even have to make any moves and complete our long and tedious hours of homework, they might not be doing that. But they are the future of medical surgery, and they will continue to advance that for us.